everyone, and welcome to today's Inside Dentistry webinar. My name is Dr. Asta Vas, and I'm thrilled to be your host for this exciting session. Today, we have an amazing speaker, Dr. Sonali, who has accomplished so much in dental profession. And whether you are a current student or a practicing dentist and someone considering a career in dentistry, I'm sure you'll find today's discussion insightful and inspiring. So without further ado, welcome Dr. Sonali.
Thank you so much for having me here. And first of all, thank you so much, Dr. Vas, for creating such a platform, Dental Student Society, as well as the Inside Dentistry seminars. I am hopeful that through these webinars, we get a lot of aspiring foreign trained dentists connect to current students in the school to make better choices when it comes to dental schools and help them in the application process. So coming to my journey and life at New York University, I would just like to begin a little bit with my background. We can go to the next slide. So a little bit about me. I was born and brought up in Mumbai in India. I went on to do my bachelor's in general dentistry in Terna Dental College in Maharashtra. I graduated in the year 2016. During my general dentistry, we had limited exposure to prosthodontics. We had limited exposure to fixed prosthodontics, and I didn't understand a lot of treatment planning that goes into rehabilitating like somebody's teeth. Like, what would you think about? Why would you want to go with a removable denture or a fixed partial denture or smile designing? I didn't have a lot of ideas about these concepts. That is why I was always interested in prosthodontics. I aim to get into a prosthodontic residency. I applied for the competitive exams that you would do back in India. I got into the residency in prosthodontics and went on to do it in the state of Karnataka. I graduated in the year 2019. After graduating, I moved back to Mumbai. I worked as a prosthodontist there for 2 years. I was involved in mostly all prosthodontic specialty cases. I used to do a little bit of general dentistry as well, but my practice was heavily limited to prosthodontic cases. While working as a prosthodontist, I also had the opportunity to serve as the prosthodontic faculty advisor for a fellowship course in aesthetic dentistry. It was a course with ILAMED, which is the Institute of Laser and Aesthetic Medicine. They used to have a fellowship which had components of prosthodontics, periodontics, and conservative dentistry or restorative dentistry. I was involved in designing their prosthodontic curriculum and also probably giving them a little hands-on and lectures about the same. The picture you see is one of the courses of the fellowship that I was involved with. Along with my work life, I was involved with a lot of civic volunteer activities during the weekends. The volunteer activities involved anywhere from beach cleanup services, park cleanups, mangrove cleanups, and also we had a lot of tree plantation activities. So I was always involved in civic activities and volunteer activities back in my home country too, prior to coming to the US. So I had a nice little life going on in my home country. I decided to move to US for personal reasons. You may come with different backgrounds. You may have a lot of different reasons moving to the US. I know a lot of my friends moved here strictly for professional reasons. They had a lot of drive and they wanted to see this part of the world and they wanted to see how this part of the world practices dentistry. I had a professional as well as a personal reason to move here. So coming to the US, I knew that it was not going to be an easy journey or a short journey either. Before moving to the US, I started speaking to my friends who were in the US, who were probably applying to dental schools or were in dental schools. Just try and understand, like how you say, test the waters. I just tested the waters, try and understand how many years would it take me, what was the financial implications, and what would be the efforts involved, because you have to understand it's not an easy journey. You are in it for the long run. It's not something that you could do in a month or two. So before coming to the US, I had my mind prepared. I knew that I was here for a long time and there would be a lot of efforts involved. Just to give you a brief about my US journey, I came on a visitor's visa, which is the B1, B2, or the traveler's visa as well. If you would know, B1, B2 visa comes with a lot of legal limitations. You would not be able to work for somebody. You would not be able to make money or you would not be able to work for somebody in exchange for money, but you could definitely volunteer. A lot of questions I get asked by people is that, B1, B2 visa definitely is considered a limitation, because you have the time limitation as well. You could not stay in the US for more than like 6 months at a stretch. So a lot of people do ask me, like, does it limit you, or what are the activities or what are the experiences you can gain in the US while being on a visa? So that's what I wanted to share. Uh, because I was on a B1, B2 visa, I wanted to make the most of the 5 months that I get in the US. And mind you, this is not something that I did in 5 months. I had multiple visits to the US. But I made sure that each visit I do something new, I do something that I could not do back home, so that I can show, like, what I did in each visit and how did I make my time count here. Um, while looking for other opportunities, I signed up for exams. I prepared for my exams. I gave my TOEFL in while being in the US. I scored 116 on that. We can discuss on that later if somebody wants any tips on TOEFL. I cleared the national boards in my first attempt. During my whole application process, I knew that I wanted something extra on my profile. I wanted something additional on my profile, something preferably with a numerical score attached to it, so that, people can gauge the, like, the efforts I'm putting in and my knowledge. And ADAT was a good way for me to do that. I spoke to people who had given ADAT. They recommended me to do it as well, so that, you have some numerical score attached to your profile as well. We have to understand that all of the applicants who are applying to CAPID, they all possibly have a good TOEFL score and have cleared the national boards. So the national boards itself wouldn't set you apart from people. So if you were to do something, if you were looking for doing something extra for you, and if you didn't mind the extra 1-2 months of studying for ADAT, you can definitely take it. The study material would be similar, a lot that was covered in INBD with a few additional subjects. So if you were to look at ADAT, you can do it within like a month or two from your INBD. That's when your knowledge is the most fresh. So I would recommend that to people who are gonna aim for it. And also, since I didn't have any hands-on experience in the US, I didn't have any clinical experience in the US, I didn't do a preceptorship or any fellowship in the US, I signed up for a bench test prep course, which was Duggan's in California. It was, I guess, a 12-day program that I signed up for, because I did want to show that I am involved in like hands-on clinical dentistry while being in the US as well. In the other column are the other opportunities that I received while being on a B1, B2 visa. And all of these were volunteer opportunities. So I was not making any money. I was doing them purely just for getting the experience on my profile, or just getting probably a certificate of volunteering from them. So I started working as a dental assistant and a front desk manager at a local dental office. I also I don't know if many people are aware, Give Kids a Smile is a initiative that ADA does each year. It's annually each year, probably starts in the month of Feb each year. And it would be dependent on the location you're based at. It would be at different times at different areas. It's basically aimed at serving underserved children in populations which are not probably served by a lot of dentists. We would go to schools and community centers. There would be a lot of oral exams involved. There's fluoride applications. There's just oral hygiene distribution. Oral hygiene aids are distributed. So it's a great day to be involved in some kind of dental initiative with the ADA. If you're once on their roster, they would send you emails for each year. So that's how you are in the loop and you know what other activities are going on. So that's a great place to start. If you're around the East Coast and if you're around New York City area, being an education volunteer at Greater New York Dental Meeting is also a great opportunity to be involved in the dental industry here. The Greater New York Meeting is again held once annually. It's held in the last week of November, I would say, each year. And if you do sign up to be an education volunteer, one of the great aspects to it is that along with the CE points and along with the volunteer certificate, what happens is you sign up to be a volunteer at one of the, like there are many seminars going on. You can be a seminar volunteer. You get to pick what seminar you would want to be interested in. So somebody, if say I'm interested in smile designing, I can choose to be a volunteer at a smile designing seminar. So I can be in the same seminar room. You would have to just usher in people. There would be a little, definitely some responsibility involved, but you can be there for the entirety of the seminar. So suppose people are paying, say, $200, $300 for the seminar, you can get to be in the same seminar room for free. So you're making, I mean, you're doing the volunteer, you're getting your CERs, plus you're also getting the same knowledge that people are probably paying for. So this is an amazing opportunity for people who are on this side of the US, or if you want to travel. I mean, they do have, if it was somebody from India who's wanting to travel for this, they also, I believe, offer you visa invite letters. So you can show that at your visa appointment and come for this meeting. It's a large meeting. You can meet many peers. You can get connected with a lot of people. So that's a great opportunity too. Colgate has a similar initiative like Give Kids a Smile. It's also based on raising oral education awareness in children, brushing techniques, oral hygiene aids distribution. I believe they also conduct their drives all over the US. You can get in touch with somebody at Colgate, and probably they have a very active Instagram page too with the same name. You can probably get in touch with somebody and see when they are doing a drive for your city, and that's how you can get involved. The non-dental volunteers that I was involved with was a local food bank that I got involved with. I would go there once weekly just to be a part of the community and distribute the food there. And I was also a blood donation ambassador at Red Cross. In the next slide, you would see a couple of pictures from all my experiences. The first one was the dental office. I learned to set up dental trays. And other pictures are from Give Kids a Smile, Colgate Bright Smiles. One of them is from the food bank, Greater New York. And the last picture you see is a very sweet gentleman I met at one of the drives at Red Cross. Uh, so what happened was I used to find these opportunities and volunteer opportunities just to probably put them on my profile. Like, oh, this will look good on my profile. This is something new that I'm putting on my profile. But through a lot of these initiatives, I realized there are people who are actually doing it just for the community, just for the, like, just for serving the community, and not, they didn't have an agenda. They didn't have like, oh, I have to show these many community hours or have them on my profile. So this was a 70-year-old gentleman I found in one of the Red Cross drives that we were doing. And he was like, he actually would drive 2 hours just to be at the drive, be there for 2 hours and go back home, like driving for 2 hours. So it's also the people you meet along the journey. You see people, what they're doing, with their free times. And that's how you realize it's, there are bigger things to life. It's not just your capid application. It's not just your CV that you're building, but also what you're doing with your time then. And like, just serving greater good. Coming to my capid experience, I was involved in Capit for 2 cycles. The very first cycle, I applied pretty late into the cycle. I would say it was like end of year, like October, November. I applied to 3 schools. It was a very mixed response. I got accepted from one of them. I got waitlisted I interviewed and got waitlisted and the other. I never heard back from the third one. The first acceptance that I had from my first cycle came very late into my second cycle, when I'd already sent out my applications for the second cycle. And since I'd already put in the money and the applications were sent out, I decided to go ahead with the with the interviews I was receiving, and decided to give a few of the interviews to the colleges that I would probably place higher than the first acceptance I had. In the second cycle, I applied to 12 schools, received 7 interviews. I chose to just appear for the 3 interviews and chose to reject the others. From those 3, I had 2 acceptances and a waitlist. Amongst my 3 acceptances, I chose NYU to be the college of my choice and decided to attend NYU. A common question that's asked is, what were the differences between the 2 cycles, or how did I improve my profile? So one thing I would suggest is, if you did apply to your first cycle, if you had a lot of interview invites, that tells you you were good on your written application. Your CV stood out to people, your SOP, people probably like your SOP. That's why they give you a chance at interview. So you need to understand what was the last step you got and you got held back, and work on that. For me, since I just applied to 3 schools and I received 2 interview invites, that kind of gave me an idea that I'm good with my written application. And that's why I didn't change a lot of my written bits. I didn't change my SOP. I didn't change my CV. I just added the new experiences, but I didn't change the layout of it. Between the 2 cycles, I definitely worked on the supplementals because I didn't do a lot of research into individual schools in my first cycle. So that's what I did. I worked on my interview skills. I did the Duggins bench prep course for my second cycle, and I did additional volunteer work for the second cycle as well. What my insights from Capit would be, still, this is just from my experience. I don't know what admissions committees look at it, but this is what my experience taught me. You have to be organized. It's like a long thing. You do your research. There's months and months of research involved. You do your writing. You have to have your CV ready. So just be organized, be thorough, proofread your application multiple times, because this is how the schools see you for the first time. The schools see your written application for the first time. So that's what you're projecting yourself as to the schools. So be organized, don't have any typography, don't have any grammatical mistakes. And for me, a good application is always better than an early application. That's what I tell people. Definitely, you have to look at deadlines. You have to see what schools are on a rolling basis and apply accordingly. But I would definitely say that take your time researching the school, take your time writing the supplemental essays really well, so that you have a good application rather than an early application. According to me, numerical scores do hold a value. So if you're attempting TOEFL, if you're going for ADAT, just make sure that there's going to be a numerical score attached to it, which may tell the person that, how you fared in the exam. So even if you were appearing for TOEFL, just make sure that it's ultimately a numerical score and people are going to put you in a bracket according to that. Just prepare well and do your best in those exams, which typically have a numerical value attached to it. SOP, in my regards, is one of the most important parts of your application. It's your journey. It's your like how you would stand out from any other applicant with the same profile as you. So SOP is something, take time to draft, have your friends, have your peers read it, and just try and understand if there was something that you could add on to it to make it more personalized or more unique to you. Supplemental essays, definitely do your research on the schools. For me, in the second application also, when I applied to 12 schools, a lot of the schools had supplementals. And looking back at my profile, I can actually tell you which supplemental answers I wasn't very good at and which supplemental answers I literally poured my heart out. So it shows, it shows to the schools how interested or invested you are in their school. Because CAPID is basically a centralized application, right? You're sending the same SOP to multiple schools. You're sending your same CV to multiple schools. So the only way the schools know that you are definitely interested in their program is through your supplement, like how nice your supplemental essays can be crafted for that particular school. So definitely pay attention to the supplemental answers as well. This is something you must have heard multiple times, having a holistic profile. That's what I feel as well. Schools don't just look at one aspect of your application. So, which also works in our favor. So, suppose if you were somebody who didn't have a good TOEFL score, but if you had a lot of other things you were doing and you were probably good at, the TOEFL score may not be a barrier because it's a holistic review, right? So, there may be things that you are good at. So, you can't have one thing holding you back. So definitely apply. Don't let any score hold you back, because it's ultimately a holistic review and you can definitely get in at schools. According to me, a good written application would get you an interview, and a good interview would get you to a bench test. So it's being good at each stage so that you can go on to the next one. Once you get a bench test, the only thing I would advise is just hone your hand skills, keep practicing, till you feel you're comfortable working in the high stress environment and doing your best. Coming to NYU now, NYU was amongst the 3 acceptances I got, and I really loved the program at NYU and chose to go ahead with it. The picture you see is the class of 2026. That's the wonderful class that we are at NYU. So the advanced planning program at NYU, it's a 28 months program, 2.5 years, 28 months. It typically accepts about 38 to 40 students per year. It's mostly 40 students. The application would consist of the CAPID application. There are a couple of supplemental questions crafted towards NYU. During my cycle, they had the Kira interview, which was an online interview. They would present you with questions. It could be personal questions or professional. And then you answer them in real time. The answers are recorded and then they review them over like the coming weeks, and then you get the result. During my cycle, which was the cycle last year, we just had the Kira as our final step. But this year, Kira became part of the application process. And along with Kira, the candidates who were selected, they were called for an in-person candidate day. They were called for an in-person group interview, I believe. Coming to the program, we get involved with the regular students through the D2 spring semester. It's called the immersion program. We get involved in D2, and then we are integrated with them in D3 and D4. A typical day at NYU would depend on the academic society you're a part of. So you have 14 academic societies in NYU. We are one of I think it's the largest class size in the States. We have 400 students in each class. So it can get too much, it can get overwhelming, it can have many people. So that's why, to make things better or streamlined, they've divided us into 14 academic societies, which would also relate to 14 group practices. You're divided into each group practice and you're paired with a D4. So each D4 gets a D3 and vice versa. D3s get a D4 and you work as a pair. So you're handling all of your patient care working in pairs. So amongst the 5 working days, we have 2 days that are restricted to our group practice. That's when you're providing comprehensive care to patients. That's when you have your roster, you have your schedule. You're providing comprehensive care with your D4. So I'm a D3, so I'm working with my D4. The clinical hours can be from 8 a.m. to 6 p.m. or 9 a.m. to 7 p.m. We typically do 5 to 7 patients a day. If you have a lot of restorative work, restorations, bridges, crowns, you would do typically 5 patients a day. But if it was mostly recalls or exams or emergencies, we do 7 patients a day. Apart from the 2 days that you work at your general practice, the other 2 days we are doing specialty rotations. We have rotations in oral surgeries, endo, perio. We also have an oral disability center in NYU. So it's one of those rotations we are doing. Fridays typically are the lecture days. We have our lectures on Fridays, and also the weekly exams that we do are on Fridays. So most of the time you're working like 4 days in some clinic involved in a specialty rotation or working with your comprehensive care patients. And then Fridays is probably didactics and exams. Coming to the opportunities available at NYU, it's, as I mentioned, it's the largest class size. There are 400 of us in each class. That also gives you an opportunity to be a part of numerous clubs. The last time I checked, they had like 45 clubs. We actually have a club carnival coming up, I think this Monday. So we have a lot of clubs. So you can definitely be a part of many clubs, get involved with your peers. You can have many connections that you can form. A great thing with a large class size is you can be passionate about any field in dentistry, and you'll definitely find people who are passionate about the same field. We have a forensic club, we have a hand dexterity club. So with a 400 class size, you know that there are people you would always find who would share your passions, who would share your interests. And you would definitely be a part of many clubs that, that interests you. The other opportunities available are the leadership opportunities. One of them is a mock congressional hearing. I believe this is something that's unique to NYU. I've not heard of any other dental school having it. I think this is something that's done mostly in law schools. Just to brief you about it, a mock congressional hearing is something like a bill would be introduced. This is what they do in DC as well, in Washington, DC, when you have a health-related bill to be passed. You would segregate the bill. You would have a party that would support the bill and a party that would oppose the bill, just to see what the two parties mean and what the factors can be while deciding if the bill should be passed or not. So mock congressional hearing is something we do where a bill is introduced and then they divide us into groups, either in favor of the bill to be passed or opposing the bill to be passed. We do our research, we understand like what are the implications if the bill passes, or what are the implications if the bill doesn't passes. So it tells you a lot about oral policies and how these policies are dissected and how these policies are passed. So if that's something, if you're interested in advocacy or oral health advocacy, this is something that can be a really nice opportunity for you. I was involved in a mock congressional hearing myself at NYU, and it was one of the good learning events I received. The other activity, the other opportunity you can be a part of is the lobby day. NYU sponsors around 10 to 12 students each year to go to lobby day in Washington, D.C. You can be a part of lobby day. You can lobby with the representatives at the House. So that's a great initiative as well. I got to be a part of the lobby day this year as well, which was a unique opportunity. If somebody was just interested in research, you have research opportunities known as DARE. There are also multiple inter-college opportunities available, like you would work with somebody in School of Medicine, School of Nursing, with any research that you're interested in. I was myself over the summer involved with a research that related with substance use disorders, and it was an inter-college study that you could be a part of. Along with that, if you were to study, if you were interested in a particular clinical stream like pros, perio, there's also something known as honors or electives that you could be a part of at NYU. This is something we typically do in our D4 year, the fourth year. There's application process and an interview involved. So if you were to study, if you were somebody who wants to probably do a residency in the future, this is a great way to go about it. You can do honors in that subject. While you're applying for residency, you can show your interest in that subject as you already are doing a honors. You get to do some select special cases if you are a honors or an elective student. So that's somebody who is clinically oriented and who probably is looking at a residency. So that's a great way to go about it too. There are many offsite practice centers also at NYU where you can do comprehensive patient cares. So that's something that's included in our rotations, and you can be a part of those as well. Coming to my reasons for choosing NYU, all of us can have different reasons. I know the 40 of us who are in the advanced dining program, I don't think all of us would have the same reason, but it depends on what you want from the school as well. How people say that it's the schools see if you are a good fit for them. I think that we also, as applicants or as candidates, have to see if the school is a good fit for you. You are going to be investing 2 years, like at the minimum 2 years of your life into the school. You're going to be investing a lot of finances into the school. So it's good to also understand if the school is a good fit for you from what you want in life. My personal reasons for choosing NYU was the extensive clinical exposure that we get. As I mentioned, we see 5 to 7 patients a day. Even if a patient is cancelled from a schedule or a patient doesn't show up or fails showing up, we always have that block filled with a new patient that comes in or an emergency. I think NYU is one of the schools with a really strong clinical exposure. You have almost approximately 1,000 patient visits a day. So you always have patients. You get great clinical exposure. Because it's a large class size, that also means you have a lot of alumni from NYU. You always have these alumni coming back. There are CE courses and symposiums by them that you can be a part of. They have really renowned faculty, people who are involved in research, people who are doing oral healthcare initiatives, people who are involved in forming oral policies. So that's something, if you're interested towards going that route, you can have great mentorship and learning opportunities with them. With NYU also comes a widespread network that I wanted to be a part of. As I also mentioned, there's honors and electives that you can be a part of. And last but not the least, the location and the diversity. New York City is a great place to be. I don't think any city would offer you the diversity that New York City offers. There are a lot of learning opportunities. You get to be with so many people who are different, who come from different backgrounds, different languages, different cultural backgrounds. So I think a lot of that you learn while being in the city and treating patients. So those are my personal reasons for choosing NYU. Also, if you were interested in NYU, they offer an open day. They do an open day each year in the month of March or April. So if you were interested, you can sign up for that and come visit in person or online. And you can also see what the school has to offer, what are the opportunities, and also meet current students if you were attending in person. And that brings me to the end of my presentation. And if you have any questions, we can answer them now, or you can always feel free to reach out to me.
Thank you so much, Dr. Sonali. It was very elaborate and did
Yeah.
feel like a small getaway to New York itself. Thank you so much, Dr. Sonali. And I would definitely say the viewers, thank you for joining in. And if you have more questions, you can reach out to Dr. Sonali directly on her social media page. And she seems to be quite active. So y'all can reach out and get your questions answered.